Hello, everyone. My name is Michael Albright. I'm an internal medicine physician and founder of Bright Med Clinic, a primary care and weight management clinic in Lansing, Kansas. Since we're in the middle of summer, today I'm going to be talking about heat-related illness. Heat-related illnesses can be mild or more serious, resulting in death in some cases. In fact, heat and related illnesses account for more weather-related deaths than all other exposures combined, including hurricanes, tornadoes, floods, and earthquakes. There are minor heat-related disorders and more serious heat-related disorders. Minor heat-related disorders are presented on this slide and include exercise-associated muscle cramps. This usually involves the leg muscles. You'll see athletes cramping up, such as during football games, and this is related to dehydration, electrolyte imbalance, and fatigue. It's treated with rest, stretching, hydration, and electrolytes. Fainting is another minor heat-related disorder. It's caused by blood vessels dilating or enlarging in the heat due to lower body temperature. So your skin's blood vessels try to give off more heat by providing the skin more surface area to the blood vessels. And when the blood vessels dilate, this drops blood pressure. A drop in blood pressure can cause a transient fainting, and the treatment for this is to lie down in a cool place and rehydrate. A minor heat-related disorder is also swelling of the hands, feet, or legs. This is also due to blood vessels dilating in the heat, and while they do this, they can also kind of leak fluid into the skin, and that's what causes the swelling. This is more common in older people or those with circulatory issues. The treatment is to elevate the limbs, such as the arms or legs, reduce salt intake, stay hydrated, and use compression socks if needed. More serious heat-related illnesses are classified as heat exhaustion, heat injury, or heat stroke. Exertional heat stroke is the type of heat stroke where young athletes exercise in high heat, and classic heat stroke is typically in older people or people with medical problems who are out in the heat, not necessarily exercising. Heat exhaustion is the mildest of the serious heat-related injuries. Heat exhaustion is related to the inability to sustain required blood flow, known as cardiac output, and blood pressure to continue physical activity. It's caused by blood vessels dilating in the skin and in the muscle, which drops blood pressure. Dehydration also contributes from sweating and not hydrating enough. The treatment is to cool the body and restore fluids and electrolytes. So basically what this is when you see an athlete exercising and they just look so exhausted that they can't move forward anymore, and they need to cool down and restore fluids and electrolytes. Heat injury is heat exhaustion with evidence of organ injury. And so what that means is the liver, kidney, muscles, or intestines might become damaged because of the heat. So you might see elevated liver enzymes or abnormal kidney function in blood work. You might see elevated muscle enzymes in the blood work. You might have symptoms of diarrhea or other GI-related symptoms caused by intestinal organ damage. But please note that heat injury does not include the brain. Heat stroke does involve the brain. Heat stroke is life-threatening. It involves brain dysfunction from a lack of blood flow to the brain. This lack of blood flow is from dehydration and also blood flow being diverted to the skin in order to lower body temperature. It's not an actual stroke, but it does involve the brain like a stroke. Usually in heat stroke, the body temperature is above 40 degrees Celsius or 104 degrees Fahrenheit. Other organs besides the brain may be damaged as well, just like heat injury. Possible heat stroke symptoms include dizziness, headache, personality changes, confusion, combativeness, delirium, stupor, unconsciousness or coma, and even seizures. Possible vital sign changes that you would see in heat stroke are fast breathing, fast heart rate, low blood pressure, and high body temperature. The risk factors for heat stroke include chronic medical diseases such as diabetes, heart disease, kidney disease, and lung disease, recent infections, drug use, elderly, and children. To prevent heat stroke and other serious heat-related injuries, it's important to prepare for any incoming heat waves. Make sure that you have access to air conditioning, fans, misting. You want to make sure you're not exerting yourself too hard in the heat with intense exercise when it's over 100 degrees outside, for instance. It's important to spread the word to maybe to your neighbor or friends and family, especially if these people are at risk, such as the elderly with health problems. And also staying hydrated is important, so have water bottles or access to water on hand. And another important preventive tip is to not go out into the heat when you have health problems. So we'll talk about treatment now for the minor related heat related problems. So we talked about muscle cramps earlier. So the treatment is stretching, hydration, and cooling for that. Fainting related to the heat. Prevention is to avoid prolonged standing in hot weather. This fainting in hot weather can occur in military recruits and marching band participants, so watch out for this in those people. The treatment is to lie down with the feet in the air and hydration. The swelling in the hands and the feet related to the heat, the treatment is to elevate the swollen limbs. And then heat rash we didn't talk about earlier, but this is basically a pimply looking rash that can occur at various parts of the body, including the legs. And the treatment is to wear clean, loose-fitting clothes and cool and dry the affected skin for treatment. Avoid conditions that include induced sweating. You can use chlorhexidine lotion or cream or low-dose topical steroid creams, and sometimes antibiotics are needed if an infection is present. Treatment of severe heat-related illnesses we talked about a little bit, but the most important thing is to get out of the heat as soon as possible into an air-conditioned space. Cool the body as quickly as possible, even before transport to the hospital. Say that somebody is having a heat stroke and they have dizziness and headache and personality changes, or they're confused. Make sure that you get them as cool as quickly as possible. Cool water immersion is the gold standard treatment. So this would be like an ice water or very cold bath. And this is where the body is immersed in the cold water from the neck down. Other treatments to cool the body quickly are removing clothing, douse the person with cold water, put ice in their armpits, groin, and all over their body, and a fan. The goal is to get their body temperature to less than 102.2 degrees Fahrenheit in 30 minutes or less. In the emergency room, this treatment may include a fan with cool mist sprayed on the body. Sometimes in the emergency room, they even provide cooled IV fluids that go in your vein. So that's part of the hydration where it includes chilled fluids to remain in the emergency department. Patients with serious heat-related injuries or heat strokes may need to stay in the hospital to recover for a day or two. And this is my reference for the talk. Thank you very much.